Hello, I'm Dr. Smolinksy. I'm an OBGYN affiliated with Riverview Medical Center in Meridian. Um, Many women have a lot of questions regarding the signs of labor. When is the big day coming? And everybody has a unique experience on this special day, but there are several characteristics that we can speak about to try to familiarize you with the signs of labor. The first thing that will happen in the last few weeks of the pregnancy is the change in your cervical aspect. The cervix will start effaced, which means really thinning, and dilate, which means opening of the cervix. The obstetrician that you go to most probably will start doing some vaginal exam towards the end of the pregnancy. And you'll find that even without feeling anything, you're suddenly 1 or 2 centimeters dilated and the cervix is starting to thin up. This is a very good sign. It's a sign that the body is working and trying to get the body to go into labor. Although some people can be 2 to 3 centimeters dilated for a while before they go into labor, it's a very reassuring sign. The second sign that we'll speak is really breaking of the water. There's 2 things that can happen when you break your water. You can either have a gush of fluid when suddenly you sit in bed or go home shopping and you feel leakage of water between your legs. The most important part is to look at the color of the fluid that comes out and to call your obstetrician immediately. The other thing that can happen is that you'll be leaking. When you leak, I always tell my patient, when you void in the bathroom and you wipe yourself, if you still feel leaking, it means that you might have broken your water and you are leaking. And again, you look at the color and you always call your obstetrician. The third thing that we'll speak is really contraction. And that's the main thing that you'll feel once labor starts. Contraction will feel like a very strong menstrual cramping that will just increase and increase in intensity. The duration usually lasts something like from a minute to a minute and a half. And they just keep coming, and the intensity increase and yet the frequency increase as well. False labor, when we have contraction that really does not change the cervix, usually are the same intensity and are very, very irregular. And that's how you differentiate between the two. At any point, if you feel that you broke your water, if you feel that you have contraction, you always contact your obstetrician. We're always more than happy to see you here in labor room at Riverview, just to make sure everything looks well and the baby is doing well as well. So we hope to see you soon and to have a nice chubby baby.